Everyone, we'll give it just another minute as attendees start to come into the webinar. All right, why don't we go ahead and get started. It's a minute after 11:30. So good morning, everyone. My name is Howard Bogard, and I currently serve as the president of the Alabama State Bar Health Law Section. On behalf of myself and the other officers of the section, Kristen Larremore, Ladmark, and John Lanier, I'd like to welcome you to the section's first webinar. Our goal is to have 3 or 4 webinars each year on topics that are of interest to healthcare attorneys throughout the state. If you have a recommendation for a particular topic for a future webinar, certainly please let us know. Now, before we get started, we have a few housekeeping items. First, during the presentation, all microphones for attendees will be muted. If you have any questions for our speaker, there is a chat function at the bottom of the webinar, and you can type out a question, and our speaker, Maddox, will either read them as they come in and answer them if appropriate at that time, or at the end, there'll be about 5 or 10 minutes where he will be available to answer questions. Next, we will be providing a copy of the slide deck after the webinar is over to those who have signed up. So you will be receiving that by email. We're also going to submit your name and bar number to the Alabama State Bar for those who have attended in order for you to receive 1 CLE credit for this webinar. The presentation will also be recorded, and so the link to the recording will be sent out to all of those people who registered. Finally, we apologize for some of the confusion on the Zoom link. The initial link that went out was incorrect, but hopefully you saw that the new link was sent out. Since you're on this webinar, I presume you received the correct Zoom link. So thank you for attending. So without any further delay, I'm honored to introduce our speaker for this webinar. Maddox Casey is the practice leader at Warren Averett's Healthcare Division. Maddox and his team works with hundreds of healthcare providers throughout the Southeast and beyond that on tax, accounting, and consulting work. I've had the privilege of working with Maddox for years now on multiple projects, and he, in my opinion, is certainly an expert in the field. Today, Maddox will be discussing PPP loans and CARES Act or HHS grants. Just about every healthcare provider in the nation, but certainly in Alabama, received one or both of these financial assistance from the government due to the COVID-19 pandemic. But like with anything from the government, there are strings attached and many details that need to be understood. And Maddox will be going into the specifics. So hopefully after the webinar, you'll be able to answer questions from your clients on these particular financial assistance tools. So Maddox, thank you for agreeing to participate and present at this webinar, and I look forward to hearing your comments. I will now turn it over to you.
Perfect. Thank you, Howard. Looking forward to doing this, and I'm honored to be, I guess, your first guest on this. So I'm going to share my screen and make sure that you guys can see the presentation. Does that work, Howard? Look good?
Yep, looks good.
Perfect. Well, as Howard mentioned, today we're going to talk about really the CARES Act, PPP loan, HHS Provider Relief Funds, and then CMS accelerated payments. While Howard said hopefully all your questions will be answered, I promise you that inside of some of these topics, there are questions that are still unanswered. So we will continue to look and dig and talk about and answer as many questions as we possibly can. And again, on some of these items, we're waiting for further guidance from the government. So again, talking about PPP, HHS Provider Relief Funds, and CMS accelerated payments is our agenda today. So I'm going to start with number one. And again, this is a review of the PPP program, what's out there, and then currently what is still existing. So I'm going to start kind of back from the beginning and talk about PPP round number one. Now, to some people's knowledge, PPP round one still exists. So this deadline has continued to be pushed back. So if you have a client who has not applied for the first draw PPP loan, they still have until May 31st of this year. That was March 31st, and then under the rescue plan, this was pushed back until May 31st. So most of our clients have done that, but I still run into people for various reasons, whether they didn't want free money from the government or whether they didn't have the time or the resources or didn't understand the program, are still out there for first draw programs. Now, as a qualification for the first round, you can see here, really any business, not-for-profit, self-employed individual. That does include those who file what we call in tax form Schedule C. I know many of you are familiar with the Schedule C, maybe filing as a single member LLC or as a sole proprietor. They are eligible even if they don't have employees. They can still be eligible for a loan. So single person, doesn't have any employees, runs a business. At the end of the day, got to tease that out a little bit, but it's basically their net income, which is being used to qualify for the first round of the PPP. Can't have more than 500 employees. So that's a caveat there. And again, this is for healthcare today, but restaurants have a little bit of a different rule there. But again, can't have more than 500 employees. And then was in operation as of February 15, 2020. And again, paid salaries and or payroll taxes. Now, in operation on that second point, there's some gray area there. You've got to have paid payroll taxes or salaries, but it's not real clear if, you can look back to, let's say your first payroll was February 22nd, but it covered the weeks before. Is that truly in business or not? You may have a situation where that comes up. So a little bit of gray there on who qualifies. Also starred here the 500 employees because there is what they call, and I've written the language down here for you, the alternative size standard. Now, this was not advertised that well, but at the end of the day, if you have a business that qualifies under these two items below, number one, net worth is not more than $15 million. All right, so looking at pretty easy, look at a balance sheet, look at their equity and see if their equity was more than $15 million. And then the average net income of the business for the last 2 fiscal years was not more than $5 million. Now, this is pretty relevant to healthcare. Most of us know that most of our practices, even larger practices, do not have net worth of $15 million. And then most of them don't have any income that they keep in the business. So if it's a large C Corp, then we're going to pay all that money out at the end of the year, therefore deeming zero net income. So I actually have one of these that qualified, large medical practice, 120 providers, does $150 million in revenue. Net income was actually negative the last 2 years, and they were actually had a negative net worth, which is not great, but they did. And so they actually qualified for a $10 million loan. So it took us a while to get there, but they did qualify for a $10 million under this alternative size rule, even though they have over 800 employees. So they've been granted, and again, not to get in the weeds on the $10 million loans, but anything over $2 million at this point has been tough to move forward into forgiveness. Looking back on how it was determined, I won't spend a lot of time here, but this again, how did we get to the loan amount? End of the day, the loan was either the lesser of 2.5 times the company's average monthly payroll cost for 2019. So add up all 2019, get the average monthly payroll cost, excluding anything over 100. So again, physician making $500,000, we can only count $100,000 toward their wages. Divide that, take that yearly wage, divide it by 12 times 2.5, gave us what our loan was at that given time. Again, the max here was $10 million. So in that example I gave you a second ago, large clinic, they actually calculated to about a $14 million loan, but they were limited to the $10 million whenever it was determined. Whoops. Yeah, so let's dig into that for just a second, because I think there's a relevant point here. Again, these are Q&As that have come from the PPP literature, but this was some point of confusion on round one, and again is relevant because annual salary, as I talked about, was limited to $100,000. So initially, when we were working all through this, about this time last year, late April, early May, everybody was thinking that $100,000 was the limit, period, including employer contributions to retirement plans, also for health insurance, and also for state and local taxes. Well, as you can see from the literature right here, that is not correct. So actually, the only thing is $100,000 in wages, and then you can include on top of that retirement plans, health insurance, and state and local taxes. So relevant in the fact that there's still the ability, if you haven't had round one forgiven, and we'll talk about that in a minute, if you haven't had round one forgiven, you can actually revise your round one and ask for more money. So let's give an example. We've got a medical practice. We've got 10 physicians that make $500,000 each. When we initially calculated the loan back in April and May, because the literature was ambiguous, we put $100,000 as their wages. Well, let's just say they have a retirement plan that includes a cash balance plan and a 401k. Well, that could be big money. I mean, that can be another $1 million between the five of those folks. And you would be able to count that and go back and revise round one if it hasn't been forgiven. So just a point to note right there. Again, I just talked about this, but reapplying and loan increases for already existing PPP that did not receive forgiveness by December 27th. So if they did not receive it by last year, they can reapply for a first loan draw. I don't know why anybody would have returned some, but they might have. Or they can modify their existing loan if they did not accept the full amount. So there's some maybe some gravy inside of that moving forward. All right, some of the other criteria related to round one. Again, if all employer retention criteria are met, we'll talk about that employer retention criteria, and when we get to forgiveness here in a minute, and the funds are used for eligible expenses, the loan will be forgiven. If for some reason forgiveness is not applied and you did not receive forgiveness, then the loan will continue at an interest rate of 1%. Anything prior to June 5th of 2020, maturity of 2 loans, and then anything after June 5th of 2020 has a maturity of 5 years. So even if you, for some odd reason, forgiveness is not attainable, this is a great finance piece, because you still have to use it for payroll. You probably still have payroll, but you've got a 5-year loan at 1%. I mean, basically unheard of, even if you cannot obtain forgiveness. So if the borrower does not apply for loan forgiveness, then the payments are deferred for 10 months after the end of the cover period. So covered period, that term is basically the period that you choose to spend your money. Now, initially that was only 8 weeks, and that was causing a lot of heartburn. So we received our PPP loan, and now we only had 8 weeks to spend it. Well, that was causing people a whole lot of crunch. They couldn't spend all the amount of money on payroll. We were getting into some of the other eligible items like rent. And so during the middle of last year, they extended this to where you could use 8 weeks up to 24 weeks, which again was a lot of relief for a lot of practices. Again, no collateral, personal guarantees here, and there's no fees related to this loan itself. Eligible expenses for those loan forgiveness. So we've got payroll cost, rent, utilities, and mortgage interest on debt obligations. So again, with the relief provided last year, almost, I would say, all of the loan applications that I have helped with, they've been able to use just solely payroll costs to use all the money over a 24-week period. And most of them were able to use it a lot faster than 24 weeks. So we haven't had to dig into any rent or utilities on our loan forgiveness piece. All right, so let's look at some of the applications that are out there. And I'm going to go through really 3 of these. These are straight from the SBA itself. This is number 1. This is what we call the simple. So 3508S is the simple application, and it's pretty much a slam dunk for anybody who has a loan of $150,000 or less. This is the front page of the application. As you can see here, again, you can Google 3508S. Really doesn't take much. You pretty much fill out all your information, what you spent on payroll costs, the amount you want to forgiven, which hopefully is the full amount. And then at the bottom, you just click on a couple certifications that says, hey, I understand that I used it on PPP, I used it for payroll, and then at the bottom that you're basically certifying that, you know, these are not false statements. So again, anything under 150,000, this took a little while to come out. This came out, I believe, in around January of this year. We had a lot of people holding because they didn't want to go through the full PPP long application. But this is the simple form, again, for anybody $150,000 or less. Number 2 is the 3508 Easy. So hence the name. This is pretty easy. And I will say that pretty much all of my healthcare practices use the easy form if they were over $150,000. This is page number 1. Again, it's got some, hey, how did we spend the money? So you can see that down here on line 1 through line 8 about where the money actually went. But bigger here were the certifications, and I'm going to move on to that. So there are really 2 certifications here. Now let's back up and remembering the intent of the PPP was really 2 things. Number 1, it was to keep people employed. So that was the right way the money was out. We don't want to fire them. And then secondly, keep them fully employed. So being that we did not reduce their pay during that time period. So that's where we first started. Now this certification right here reduces one of those qualifications. And so let's look at number 1 here, and I'll read it out a little bit to us. But the borrower did not reduce the number of employees or the average paid hours of employees between January 1st and the end of the covered period. So did not reduce the number of employees and did not reduce the average paid hours of that time period. So that's the certification that you're making at that point, which most people in compliance with the law, they qualify for that. Now, what makes it easy here is the second part, which basically says between February 15th of 2020 and the end of the covered period, again, the end of the covered period meaning when you received your loan until when you used it all, at the same, the borrower was unable to operate, between that time period at the same level as before then. So February 15th is a big date, right? About a month really before the world fell apart back in 2020. But it's basically saying we were unable to operate during that time period, February 15th, at the end of our time period, due to compliance with guidance issued between March 1st, 2020. So there really wasn't much issued before March 1st of 2020 and December 30, 2020, established by HHS, CDC, OSHA, blah, 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 blah. So again, most of the guidance issued here during this time period by the CDC, by HHS, was that we should not be doing what we're doing in medical practice, either shut them down, whether it's elective surgeries. That's an easy slam dunk. But again, we weren't able to operate at the same level because of those guidances that were issued. So we've been using that as a pretty much stronghold for the easy application. And again, it keeps you from going through the full application of having to do all the calculations of did you keep your full-time employees and did you, there are all those calculations that are required in the long form. So again, 2 certifications here for the easy application, 3508 easy. And again, that's the one I'm recommending that most people use, as long as they feel comfortable signing that both of those certifications, but in particular, the second certification. So those are the, again, application. There's a long application out there. I didn't show you that. It's pretty detailed and takes quite a bit of calculations to get through that. I'm not having many people having to use the long application, but if they don't qualify under EZ or S, then again, they would need to go to the long application. So we move into PPP, what we called round 2, which were the second round loans. And at this point, there were about $284 billion that were allocated for the second draw loans. Also during this time period, as I've talked about, you are now permitted under this law to use a covered period between 8 and 24 weeks. So again, that applied to 1, that also applies to 2. The literature just came through whenever the second round came through. So again, you can pick and choose the number of weeks that you want to use. It's not an 8 or 24, it's somewhere between 8 and 24. We already talked about the simplified forgiveness. That all happened at the same time as the second draw. So that was that 3508S that I talked about. So that form came out right when this came out. And then really back to the second draw loan. So who qualifies for a second round? So first of all, you had to file a first, and that's number 3 here. Borrower who has not received a first draw PPP loan, has not used it all, is not eligible for a second. So you had to at least do the first loan before you could do the second loan. You couldn't jump straight into the second loan. New qualifications here, instead of being 500 employees, it was knocked down to 300. So 300 or fewer employees for a second draw. And then lastly, and the biggest, and the reason most people did not qualify, was that you had to show a 25% reduction in gross receipts in any quarter of 2020 as compared to the same quarter in 2019. So these were calendar quarters, January through March, April through June, July through September, October through December. So you could not pick any quarter that you wanted. You had to use calendar quarters. Look at it, 2020 versus 2019, and you had to have a 25% reduction in those receipts. Now, I would say of what I've looked at from these numbers, probably less than 5% of my clients have qualified for a second round loan. And I'd love to hear from y'all if you are involved in seeing more than that. But it was tough to show a 25% reduction. Most people, again, kind of shut down at the end of March, but those revenues continue to flow into April. And so their Aprils, while down in production, were not down necessarily in collections. And so they, again, were shut down kind of through that April. So they had some really bad late April, May months. But man, when the doors opened back up, when we were right around June, they were running. So most people at that point did not show a 25% reduction. Primarily, I've seen this in the dental world. So since they were truly shut down for a time period, doors closed all the way together. A lot of them qualify. Dermatology saw a pretty big hit. Elective surgeries like general surgeons may qualify. Maybe some gastroenterologists could have there. And then, of course, plastic surgery took a huge hit, most of it's being elective. So those are the specialties that I'm seeing where people would qualify for a second draw loan. And again, through the chat feature, I'd love to hear if you've got some other specialties that qualify. All right, so that's basically our PPP. So now we're going to dig into what I call a little bit of the messy. And this is still messy in my opinion. In fact, I was trying to help a client recently with some of this PRF and how to spend the money. I'm going to move you through some of the questions and answers, the FAQs that are on the site, and probably give you a little bit of where I think some of this stands, and then where do we go from here. So number one, pretty much $178 billion was distributed through the PRF. Yes, $178 billion in free money came through the PRF to medical providers, hospitals, facilities, rural health care. Everybody that was billing Medicare received a piece of that. So they do not need to be repaid back to the U.S. government, assuming that we comply with the terms and conditions, which are a little bit of a struggle at this point. Now, before we dig off of that, I do want to talk about tax treatment. So the PPP loans were deemed at the end of 2020 to not be taxable. So again, into 2020, the amount of money we received for PPP is not taxable, which was really quite amazing. First time I remember someone receiving free money being able to take the expenses related to the money they spent and did not have to pay tax on the money. So a lot of providers that was a big woohoo, and that was a very nice year for 2020. So logistically, that was not taxable. Now PRF is taxable, and since most of our healthcare providers are on a cash basis, and this money was received in 2020, most people should have recognized income on their tax returns related to PRF in 2020. So PRF is taxable, PPP non-taxable. And again, neither one of them have to be repaid. Again, PPP used appropriately, not repaid. PRF, if used appropriately, will not have to be repaid. We're not to that repayment period yet on PRF. Let's talk about it a little bit. So again, how do we get there? Again, phase one general distribution, $30 billion was the first thing that came out. That was based on what you billed Medicare for 2019. So your pro rata share of the total amount that was billed to Medicare, which again was $453 billion. So whatever you made up of that share times 30 billion, you received. You know, a little piece of information there, which was really neat to watch. I guess it was neat to watch is those people who bill Medicare for, let's say, drugs, infusions. So think oncologist, rheumatologist, you know, they receive their share of the PRF based on that. So let's take $150 million oncology practice, where 120 million of that 150 million are drugs that they infuse. And again, they pay for them. So their margins are the $150 million practice. They may not spend 120 million of that revenue on drugs they're having to buy. But through PRF, again, all of what they had billed for Medicare for those drugs, they received a nice little lump sum. So easily $150 million practice could have easily received in excess of $2 million in a PRF loan, PRF proceeds because of, you know, again, heavy Medicare from an oncology usually, and again, the ability of what they do from a drug standpoint. Same thing for rheumatology as well. That was a side note. Number two here, additional 20 billion, again, was pushed out in the initial as well. And then this was what we kind of had called as the true up. You know, if you didn't bill Medicare, so for an initial 30 billion, this is where it was made up. So like our pediatricians that don't bill Medicare, even some dental providers, and we'll talk about this in a minute. This is where the true up happened, and most people began to receive additional payments. OBGYNs, they don't do a heavy Medicare volume as well. Their first initial, they were pretty angry. You know, they were getting like $223 in their account when all of their colleagues and other specialties were getting hundreds of thousands. So you can imagine how that went. This is, again, phase two here. This was based on, this is where I'm not going to read through all this, but this is where dentists really got kicked in. Anybody with Medicaid chip showed up as well. But this is where they received the remaining amount of their money. And at the bottom, you can kind of see where this all fell out. But those who received a phase one general distribution are no longer prohibited from submitting an application under phase two. But those who had received a previous phase one distribution are eligible to apply if they had not received approximately 2% of their annual revenue. So under phase two, and ultimately everybody got to at least at a minimum 2% of their revenue. That was what happened in phase two. Now under phase one, if you had already received in excess of 2%, then you did not receive additional money. So those people I talked about earlier did not receive more money, but under phase two is where really kind of the true up happened along those fields of pediatricians and OBGYNs and et cetera. There was a targeted distribution. Not going to spend a lot of time talking about the targeted distribution. This will be in the slide. If you work with any of these providers, if you work with any SNFs, if you work with any safety nets or even rural distributions happened as well. So they received magical money in their account. So let's talk about the reporting requirements. And again, this is where it gets a little bit gray here. But number one, once you received the money, you had 90 days to attest inside the portals that you received the money and that you accept the terms. Now, if you did not attest for that, not actively attesting will be viewed as acceptance. So ultimately, either you said no and did not attest, or you did not attest at all and you were deemed accepting the funds. Again, if you rejected the payment had to be returned to HHS within 15 calendar days. I don't know of anybody personally that rejected the payment or and paid the money back just because the terms were so unclear on what we could use it for and can use it for. And most people are still holding a lot of this in their bank account, or either paid it out and are waiting to see how they can use the money. So again, how to do this, the requirements of using this. Again, this is not exhaustive, and we're going to talk through some of this in some of these FAQs. But number one, to be eligible, you had to provide diagnosis, testing, or care for an actual COVID-19 patient after January 31, 2020. Now, HHS put a nice little doozy in there for us, and they said HHS probably views every patient as a possible COVID-19 patient. So again, thank you for the first sentence, but thank you not so much that now it's every patient is considered a COVID-19 patient. So if we're doing any care, then we were deemed okay. So I'm not really even sure why that's there, but it's there for the taking. Number two, payment is used for prevention, preparation, or response to the coronavirus. And those terms are the terms they continue to say: preventing, preparing, and responding, and or healthcare related expenses or lost revenues. So you've got all of those areas that we're going to talk about on how we can spend the money. And then again, payment will not be used for expenses or losses that have been reimbursed from other sources. So if you've received other money elsewhere, you can't double count that money as well. And then again, there is public disclosure of this payment. Just PPP, public disclosure. This is a public disclosure as well. You can go and see what everybody's received. All right, so we're going to jump into some FAQs related to this. When do we have to use the money? So this still holds true. I checked the website this morning to see if there had been any more modifications to the FAQs. The last set of modifications did happen on March 31st. So it's been about a month and a week since we received any of the literature, but we still must use the money by June 30th. Now that's coming up quick. We're a month and a half away from that, and you've got to expend it by that time period. So note there, I would not be surprised if that gets extended out, just because the terms are still out there and a little bit gray on where to spend it. Again, reporting on this. So again, you have your normal use of accounting whenever you do report these. So these are the reporting instructions. And again, these are the two areas I talked about a second ago. Let's go back over them. Anything that we spent attributable that another source has not reimbursed, which does include our G&A and other healthcare related expenses. And then number two, those that we did not use on healthcare related expenses, then are applied to patient lost revenues. So that's the order there. That's why this is important. So we have some slam dunk stuff, and I usually call these the UV filters, the plexiglass, the additional PPE, really anything that you did that was incrementally more. So hired a security guard for, COVID patients, or did a COVID drive-through vaccine and or COVID testing. All of those are incrementally more money that you spent, and those will qualify. Once you get through the slam dunks, then you've got to go on to section 2, which is really money that we lost revenue year over year. And we're going to talk about how that looks here in a second. So here's who I'm talking about. These are your slam dunk expenses. So general and administrative, these are straight from HHS. So this is, I've underlined for you here, occurred over and above. So I think it's critical that, mortgage and rent, if you've already had a lease in place and you didn't rent more space or lease more space, then no, you cannot use, there are no incremental expenses. So you cannot use any PRF. Now, if you, like I said, if you rented a side building or you rented some additional facilities to do something related to COVID, sure, then that would count as incremental expenses. Insurance, if you bought any more insurances, personnel, again, this would be anybody that you've brought in, probably a little gray there, right? Anybody that you did bring in, you probably could justify that they related to COVID and or treating COVID patients, since every patient's a COVID patient. Any additional fringe benefits. So again, supplemental bonuses here for employees, hazard pay. A lot of people gave superhero bonuses, hazard bonuses, reimbursements, anything that we increased on employee health insurance. Anything that we did in that regard would be used, or your PFR funds can be used for those. Again, leases, utilities. I talked about, lighting, cooling, ventilation. Again, a lot of people did the UV lights and or the high-level HEPA filters in order to help control this. So those would be additional funds used as well. And then again, other G&A expenses. These are just some guidelines that are currently out there of what we can use. Again, number 2 here then is, once we've kind of gone through that, and I'm just going to tell you what my experience is that, even counting everything that we just talked about, let me go back, counting all of this right here, most people are having difficulty saying that they spent that amount of money of their PRF. So, I mean, if you received, $200,000, $300,000, this is tough for them to be able to say, I've had that much more in incremental expenses. They may have 40 or 50 or 60 is kind of the normal number I'm hearing on items they did related to this first tranche of the usage of funds. So again, anything that was not fully expended at that point that you did not use on the slam dunk expenses, then you've got to look at the second test, which is really the patient care lost revenues. And this is the way that it's defined of lost revenues. So you really got 2 things here. I think one that's applicable for most of us, but it's really the difference between 2019 and 2020 actual patient care revenue. So it doesn't talk about quarters here, it talks about 2020 versus 2019. So when we look at actually what we received in revenue, did we actually take a hit? Now, if you did, so if you can justify that your 2020 revenue was down as compared to 19, then that PRF payment is most likely going to be yours for the keeping. So again, I've got a client who lost about $800,000 year over year, and their PRF was less than that. So they feel pretty comfortable, and I feel pretty comfortable that they're going to be able to keep that amount of money. Now, tough here, if you had a better 2020 than you did in 2019, that's going to be tough to justify. Number 2 here, again, we're talking about budgeted. Most people, I don't think, hold a budget, or most of them did not establish a budget prior to March 27th of 2020. But if they did, so they did a 2020 budget that they can prove that was actually done before March 27th, kudos to them, and versus what they actually received, and they can count that as lost revenues. Unfortunately, most people, unless they're large facilities or large centers, are not doing a budgeted amount. And then lastly here, there's a lot of words here. I'm not going to read them all. This will be here for you. But, really any reasonable method of estimating revenue. So if you've got any reasonable, again, it's as gray as it can be, right? Alternative reasonable method of why we did it. Now, in the middle of this, it does talk about if you are using this alternative method, you're probably going to have a likelihood of an audit. I think this is probably tough to get through. You're going to get looked at. And again, you've got to have some way of saying why you lost the revenues during that time period. So it gets out there if you want to push the envelope a little bit. But again, that's going to be tough to do in my opinion. Okay, so definition of individuals I talked a little bit about this, but again, I just want to reiterate that individuals with possible actual cases of COVID. So unless it's associated specifically with testing or treatment, providers are eligible only if they provided care after 31/2020 for care of individuals with possible actual cases of COVID. Again, I already said this, I talked about it earlier. End of the day, all patients are pretty much going to qualify. That was added back in May of last year. Another FAQ I think is applicable here is, in order to accept the payment, must the provider have already incurred eligible expenses and losses? No. So they don't have to prove at the time that they accepted it. So the acceptance of most of this happened late fall of 2020. So again, they did not have to prove at that point that they had it, but they do have to spend it by June 30th. Now, this is coming quick, like I said. So a lot of people accepted the money last fall, and now here we are bumping up on June 30th with little guidance or literature, in my opinion, on how to spend it other than the two items we just talked about a second ago. This has been asked by a lot of people, but, can I spend it on my personnel? Can I spend my PRF? And again, they say here, yes, you secure, maintain adequate personnel, secure and maintain hiring bonuses, retention payments, child care, transportation, housing. All of those items are deemed PRF expenses. So again, if you get down, I don't know what's going to happen here, but I mean, if you're going to pay that money to the federal government, I'm not necessarily advising this, but I can envision that people are going to, instead of paying it back to the government, why would you just not give your personnel some bonuses? I mean, seems like that would make logical sense before we paid the money back to the government. But again, that's my take on it. That is not my official advice. Some capital expenditures. So a lot of people have asked about, hey, can I spend the money on equipment? And the answer to that is yes, you can, and it can be fully expensed, only in cases where it was directly related. So here's the type of stuff they've listed below in their literature. So, ventilators, stuff easy for the ICU, PPE, mask, face, gloves, gowns, suits, personal protective equipment, disinfectant supplies. Again, you get down to some strategy here. If you're going to pay the money back, or would you just stock up on years upon years of PPE? Sure. I mean, you probably would. I'm not sure how much money you could spend, but you could probably spend quite a bit on the highly expensive PPE as it stands now. Again, this is looking back to some additional, this is more of capital equipment as well. So capital facilities, again, only when you're preventing, preparing, and responding to coronavirus. And you've got to be able to say, I'm preventing, preparing, or responding to it. And they talk about some of these upgrades as examples. So HVAC, again, UV filters, COVID-19 unit obviously would qualify. ICU, most of us aren't dealing in that world, but again, a lot of money spent there. Purchase temporary structure screens, and again, anything permanent facility to increase capacity. So that's the examples. A lot of people are trying to think that, hey, can I spend something on a new ultrasound machine? I personally think that's probably a stretch. I mean, how could you say that a new ultrasound is, responding or preparing or preventing corona? I think that's going to be tough. I think you got to be more down into something that's really due to it. So lab, if you're setting up a new lab, yeah, you're testing for corona. I mean, I think some of that would be a lot easily validated versus, just a new piece of equipment for our practice. Again, G&A here, I talked about this. I'm not going to reiterate here, but again, this is back to the hiring security personnel and hazard pay is in your slide if you would like. And then the registration is open. So again, there's no deadline at this point for registration in the portal. You can Google PRF portal and it'll pop up if you need to guide your clients through it. It takes about 20 minutes to register in the portal. I have advised that most people do register in the portal. That's where they do kick out additional literature. So if they're going to change anything here in the next 45 to 50 days, then it'll probably be pushed out through the portal first, and they'll give you notification about the amount of items that we need to use. So anyway, register for the portal, and that's really for anybody who received $10,000, which is pretty low threshold. Most people have received at least that in the PRF. One thing you need to know here as well is we call this the Full Employment Act for Accountants. Yes, I said that out loud. But anybody who received a total of $750,000 is going to be subject to what we call a single source or single audit requirement. Again, this is gray as well. We've got our auditors working on it on, how are we testing for this? Because it is a single source, not a full-blown audit, but it's a single source, and they're going to have to go through, unfortunately, a compliance audit has no value to them. But basically, it's government money, and if the threshold is $750,000, they're going to have to go through it. So we don't have any clients that we've done this on yet, but we've been talking about it for a long time. And I would just make them aware that, again, if they've received over this amount of money, they need to be contacting their accounting firm or whoever's going to actually do the audit on that single source when the time time comes. All right, then our last topic, and then we'll have some time for questions as well, is talking about the CMS Accelerated and Advanced Program. And again, that's a pretty short topic here, but again, back in March, the Advanced and Accelerated program was given out to providers. They paid out Part A providers of more than $98 billion during that time period. And then Part B as well received another $8.5 billion. So again, looking at what they received, what they had previously billed, and then accelerating those payments into the providers' pockets. I will make a note here from a medical practice side. This, from the hospital side, a lot of them needed this and had to keep it in order to get through the pandemic. So a lot of them held onto that money. If you're working with a medical practice, most of these either one did not take it or either two returned it. And a little bit of a rabbit trail here, but I think it's tough because you're receiving money that's later going to be recouped through Medicare. So if you think through a compensation formula with a group of 5 doctors, you received, I don't know, $500,000 in payments. Well, when they recoup it, you're going to have the mechanics or the mechanism in place in order to know where they're recouping it from, because they're not, each doctor got $125,000 of that $500,000. Well, whenever Dr. B, if he gets paid based on his production, his collections, well, if Medicare recouped and pulled out of his claim, you're going to have to figure out where they're pulling from and then tie it back in. So it really made for a nice little accounting nightmare if people kept it, or will make for an accounting nightmare whenever the recoup has. And most people, after they received PPP and HHS, really didn't need this to get through, again, from a physician practice side. So I had been advising that most people pay this money back. Otherwise, it's going to be a real mess whenever you come through. Plus, retiring doctors, the recoup of this is going to take a while. So the receipt of the money is effectively taxable income. How do you shift that up? So let's say a doctor received a piece in 2020, but then they're not there to pay it back. That's tough. I'm sure we can paper that, their contract that they need to pay that back. I know Howard could do that easily, but we would want to make sure that they were on the hook for that in post-retirement. So if you did receive it, though, let's talk real quickly about what's out there. Repayments delayed until 1 year. So again, it is pretty much interest-free here, but for 1 year. After that first year, they're going to recoup 25% for the next 11 months. That's a long time period. So you look up, and that's already been a year. Then we've got another 11 months from there. They're going to work on recouping just the first 25%. And then after that, so we're at 23 months, they recoup to the 50% for another 60 months. So after, let's see, that's 29 months. So almost 2.5 years, they've only recouped 50% of the money. And then again, if they're unable to repay the total amount during this time period, they'll issue letters, and again, subject to an interest rate at that point. So anyway, that is on the accelerated advanced program where people received money. A couple questions here. Again, these are, I thought, were humorous, but end of the day, can I pay off before the repayment begins? Yes. Please contact your MAC. So you can pay it back. Number 2, can I ask for reconciliation? Sure, ask your MAC. So when I was looking at the FAQs for all this, pretty much every question is ask your MAC on what to do. So if they've got any questions about that, contact the MAC. And again, they can pay it back. And if they want to know where they stand at any given time through the reconciliation period, they can certainly ask the MAC. So that's my email and phone number. So again, if we don't answer your question here in a minute, or you have further questions or any really issues you've got, I'm happy to help you walk through this and be of a resource for you. Thanks, Howard. I did not look at the chat. Do we have any questions sitting in the chat?
I do not see any questions unless I'm looking at it wrong, but I do have a question for you, Maddox, unless there's others. Did
Sure.
you see anything in the queue? I do not.
I do not.
Okay. So here's a question for you. Despite COVID, there's actually been a fair amount, in my experience, of merger and acquisition type activities where physician practices or hospitals or other healthcare providers are being sold. In many cases, these entities have a PPP loan that may not have been forgiven yet. And I know that creates a little bit of complexity. Do you mind addressing what the options would be in that type of situation?
Sure, happy to. And that's a little bit of a heartburn right there for me, Howard. So thanks for reminding me that I had a client who went through a merger acquisition and did not, we knew about it a little bit, but we weren't helping them. And they did not alert the SBA that they were going through it. Now, ultimately they were okay. But at the end of the day, if you're going through more than a 20% of ownership change, so 20% of an ownership change, you have to alert your lender, so your bank, and they have to get prior approval, which they usually have 60 days to give you, that you can actually go through with the merger. So especially if your loan hasn't been forgiven. So you're in the middle of a forgiveness time period, either with round one or round two. Let the lender know that you're going to go through more than 20%. And then again, you got to wait for approval before you do it. Now, I will tell you, my experience with it was we unfortunately went through with the transaction, and I guess the SBA was generous, and they still granted the forgiveness. But I would not lean on that. I'd definitely get prior approval. Great question.
And I to add to that, I think if the approval isn't received, the forgiveness isn't received by closing, the latest guidance I think I've seen from the SBA is that the bank may require that you put a certain amount in escrow, actually in escrow the amount to cover the loan in the event the SBA decides not to forgive it, so they know that there are funds there to pay the loan, which obviously as a seller, you're putting a fair amount of cash in escrow, maybe from the purchase price even, that could sit there for a while until the loan's forgiven.
Yep, real tough. But yes, you're exactly right. They are requiring that in escrow.
All right. See if there's any other questions. I do not see any. So we can end a few minutes early. Maddox, thank you so much for presenting. That was very helpful, and I'm sure that's kept you and your colleagues very busy this past 13 or 14 months. There's a lot of complexity, a lot of accounting that goes along with it. And so for those of you who are attending, I hope you enjoyed and found helpful our first webinar. Again, we will be, as a section, trying to do several of these each year, hopefully 2 or 3 more, or probably 2 more this year. So if you have a topic that you're interested in, please feel free to email me or any of the other officers, and we're happy to try to find a speaker on a topic of interest. And with that, I hope everybody has a great afternoon. Thanks for joining us.
Thanks.